Today I'll discuss about patient counseling. In this session, I will be discussing the definition of patient counseling, the aims and objective of patient counseling, the different steps involved in patient counseling, communication skills essential for patient counseling, and the barriers of communication in patient counseling. So let me begin. As you all know, professional patient medication counseling is actually the professional counseling given by a practicing pharmacist to his patient or patient representatives on matters related to the prescribed medications, healthcare, and lifestyle changes if required, with the objective of increasing patient compliance to the prescribed medications and thereby promoting rational, scientific, and prudent use of medications. The aims or outcomes of patient counseling include better patient understanding of their illness and role of medications in the treatment, improved medication adherence, reinforcement of advice from primary healthcare team. It leads to more effective drug treatment, and it may reduce the incidence of adverse effect and unnecessary healthcare costs. Ultimately, it will lead to improved quality of health of patient. Patient will be better coping with the medication related adverse effects, and there will be an improved professional rapport between the patient and the pharmacist. Now, I'll discuss about the steps involved in patient counseling. The various steps are preparation for the session, introduction or opening of the session, content of the counseling, and closing the session. First of all, preparation for the session. Mental preparation. Pharmacists should spend a few moments mentally preparing for the interchange that's about to occur. Pharmacists should know as much as about the patient. So for that, he should collect information regarding the patient. The pharmacist should know as much as about the patient before approaching by the patient or the caregiver. In the hospital setting, this may be possible through reference to the patient's case notes. In the community pharmacy setting, sources of information include the patient and their prescription, and in some cases, the record of previous dispensing of patients. Also, the self-observation of the physical state of the patient is important. Observation of patient prior to counseling session can reveal many clues about patient's physical and mental stage. That's all about the preparation for the counseling session. Next is introduction or opening of the session. It is important to conduct appropriate counseling introduction by identifying self and the patient or the patient's agents. The healthcare professional should introduce himself or herself to the patient or patient agent and ask if the person is the patient or caregiver or someone simply picking up the medication for the patient. It's important to explain the purpose of the counseling session. The healthcare professional should prepare patient or patient caregiver for information to be presented and explain why the information is important to the patient. It's also important to review patient records, as I already discussed, prior to the counseling. It's important to be familiar with the patient history and file before the encounter. This will save time and identify areas of special emphasis and assure the patient that the counseling session was as thorough as possible. Next, it's very important to determine if the patient has any other medical conditions which could influence the effect of this medication or enhance the likelihood of an adverse reaction. Also, it is very important to obtain pertinent initial drug-related information. For example, if the patient is having any allergies or the patient is taking any other medications, and see whether there is drug-drug or drug-disease interactions. It's very important to check. It's also important to assess the patient's understanding of reason for the therapy. It's extremely useful for find out what the patient already knows. Doing this as the potential for saving time in the counseling session and reinforces learned information. In addition, any incorrect information could be corrected at this time. Assess it's very important to assess any concerns or problem of importance of the patient. Patients are often reluctant to vocalize concerns unless they are asked. It's important to deal with this issue early in the conversation, and otherwise patient may not be listening to the information attentively. The healthcare professionals should make understand the patient's concern, every step to understand the patient's concerns and give those concerns the attention they deserve. Trade name, generic name, common synonyms or other descriptive names, and when appropriate, its therapeutic class and efficacy. Counseling can be verbal, accompanied by a written material or electronic mode. Verbal communication refers to face-to-face communication about medicines with the professionals. Counseling aids are a variety of teaching or educational aids that have been developed to assist patient counseling. A written mode of information refers to all kinds of written materials designed for patients and medicine users, such as patient information leaflets, medication cards, books, articles, drug packages, and labels. An electronic mode of information refers to all kinds of communication on medicines with the help of information technology such as internet, interactive television, data links, and mobile communication. All these should be known by the pharmacist before proceeding, and the pharmacist should be experienced with all these modes while doing a professional counseling. So, before moving in detail about the contents of the counseling, I was just discussing what are the different materials, or what are the different ways of communication in counseling. So as I already discussed, the content of the counseling may include the medications, different names, different types of names. Then we can discuss about the medications use and expected benefits and action. This may include whether the medication is intended to cure a disease, eliminate or decrease the symptoms, arrest or slow the disease process, or prevent the disease or symptoms. Then we can discuss about the medication's expected onset of action and what to do if the action does not occur. In the cases of certain medications, we can, wherever it is needed, we can give the directions for preparing and using or administering the medications. This may include adaptation to fit patient lifestyle or work environment. Also, it is very important to discuss to the patient about the actions to be taken in case of a missed dose. The pharmacist can also discuss about the precautions to be observed during the medication use or administration and the medication potential risk in relation to benefits. For example, for injectable medications and administration devices, concerns about the allergy may be discussed. Next, potential common as well as severe adverse effects that may occur may be discussed with the patient. It is very difficult to discuss about all the adverse reactions, and it is not needed also, because the patient may get anxious if we are going to discuss all the adverse effects. So we will focus on common adverse effects as well as the severe ones, and we can discuss what action he or she has to take to prevent or minimize their occurrence, and what action to take if the adverse event occurs. Like where the patient can notify the prescriber, the pharmacist, or other healthcare providers. Then we can discuss about the different techniques for health monitoring or the self-monitoring of the pharmacotherapy. Like for example, if the patient is a diabetic patient, they can be advised about how to use a glucometer and self-monitor their blood glucose level, and to know by that they can know the progress of the therapy. That means how the therapy is improving their condition. Also, the pharmacist can discuss about the potential drug including non-prescription, that means OTC drugs, drug interactions, drug food interactions, and drug disease interactions or contraindications. Sometimes the timings of certain radiology or laboratory procedures can interfere with the drugs, okay, with the drugs dosing. Sometimes the drugs may affect the laboratory interpretations or radiological interpretations. So in that case, we can make, if such cases are there, we can communicate to the patient or the physician if needed. Then the pharmacist can tell about the refill authorization, prescription refill authorizations, and the process for obtaining the refills. Then we can instruct of a patient regarding the instructions for 24-hour access to a pharmacist by giving the mobile phone number or the office number or the email ID or any other facts about the pharmacist, which will be helpful for the patient to contact the pharmacist. And storage is very important in the case of some certain drugs like insulin. So in that case, we can inform the patient. And sometimes some drugs may be very harmful to the environment. So in that cases, we can tell the patient to how to dispose the expired medicines or unused medicines, or the sometimes in the case of administration devices like inhalers, how to dispose it properly. Also, any other matters related to that is unique to a particular patient can be discussed during the heart of the count. That means while we are delivering the content of the counseling. Now we are concluding the session or closing the session. So during that time, we have to verify the patient's understanding. It is essential to check patient's understanding. This can be assessed by feedback questioning such as, can you please remember what is this medication for? And we can also tell the patient to summarize the main points in a logical order, and we can then emphasize the key points of information. We can also give some time for the final concerns and questions, if any, and we can tell the patient when he or she is due back to refill. It's very important that we help the patient to follow up, give appropriate for numbers to the pharmacist, and details to encourage the patient to make contact if they need further advice or information. It's very important to thank the patient for spending time for discussion. We can do that, and we can do the documentation, that is our official matters after that. Okay, so that's all about the steps involved in patient counseling. So, as we all know, like many times, patients are very busy because they are after the routine health checkup. The place they visit last in a hospital will be the pharmacy, and ultimately they just want to run away from the pharmacy with the medicines. That is their attitude. So it's very difficult to convince them for the counseling, as well as many times the pharmacist may be dispensing a lot of prescriptions, and there will be a lot of busyness in the schedule of the pharmacist. In that case, it's very difficult for the pharmacist to get a proper time and set up to counsel the patient. So we can prioritize whom we should counsel more, or which are the priority group that should be counseled. So we should always counsel confused patients and caregivers. For example, many of the mothers of the pediatric population may be confused, and then they should always be counseled, because if somebody asks you some doubts, or they express their confusion, it is mandatory that we go for counseling. And patients who are sight or hearing impaired, for the hearing impaired, we can give some writings or leaflets or something like that. We have to give the written information rather than telling something. And for those who are having sight problem, they may be very difficult for them to read or read the directions on the medicines cover or medicine. So in that case, we have to tell them and make sure that they understood our points. Then patients with the poor literacy, who are not able to read and write, they may not be able to see the directions on the medicines or the medicine covers. Okay, so they may not be able to understand that. They should be counseled. So patients who changes their medications or dosing, they can be counseled. Those who are receiving a new medication, for example insulin pen, inhalers, they may be using them for they may be using it for the first time. In that case, they are not experts, so they need some sort of guidance from the pharmacist side. So it's very important to counsel them. Then children and parents receiving medications, that like children should always be the children's parents, actually it's not the children's parents should be counseled properly. Then patients on anticoagulants, because there may be chance of bleeding tendency, so that should be counseled. Patients with specific storage requirements, complicated directions, and significant side effects. Those patients which I discussed now, they should always be counseled, but these are a set of patients who may need counseling at certain intervals. For example, asthmatic patients, diabetic patients who are using insulin, they want to know we have to make sure that the insulin is working for the patient. The asthmatics, we have to make sure the inhaler is working for the patient. These are instances where counseling may be required at intervals. Patients on polypharmacy, to check whether they are having any adverse effects, they are adherent to the medications, all those things. Patients who are mentally ill, many times they may be forgetting to take the medication, or they may not be interested to take medication, and they'll be showing their relatives and others that they are taking it. So it's our responsibility to make sure they are taking medicines. Then patients who are using appliances, that I already discussed. Then epileptic patients, maybe counsel at intervals. Patients with skin complaints, patients misusing drugs, patients who are terminally ill. All this may be counseled at certain intervals. Now we will move to the communication skills needed for effective counseling. The counseling process uses basically two kinds of communication skills: verbal communication skills and non-verbal communication skills. First of all, I'll discuss about the verbal communication skills. Verbal communication skills include language, tone, volume, speed, technical jargon, use of open-ended questions, use of paraphrasing, assertiveness. These are the verbal skills. First of all, I'll discuss about language. When speaking to patient, use simple language and avoid using unnecessary medical words. If possible, speak the patient's own language. Next is the tone. Changes in the level and range convey the information about one's feeling and attitude. So, uh, the tone of the voice should be caring as well as reassuring. Next, the volume. Ideally, counseling should be conducted in quiet private setting where there is no unnecessary uh, voices, and it is not needed to raise one's voice also. Although it may be necessary to speak more loudly to a patient with a hearing problem, but in that case also it is more beneficial to speak more closer to the ear of the patient rather than raising the voice. It is acceptable to speak in wide variation in volume depending on situation and where and to whom actually the pharmacist is speaking. Next, the speed of counseling. Patient may be reluctant to interact with the pharmacist who speak quickly because they may feel the pharmacist is too busy. In contrast, the listener may lose interest if the pharmacist speaks too slowly. For good verbal communication, the pharmacist should present clear, relevant message in a logical sequence and at a speed that is understandable to the patient. We should give some time for the patient to think about what is being said. Next, the use of technical jargon. Jargon is the language of specialized terms used by a group or professionals. For example, advocates may be having their jargons, engineers may be having their jargons, and physicians may be having their technical jargons. The unnecessary use of technical terms may increase the patient's anxiety. If the use of technical terms is necessary, they should be explained after assessing the patient's understanding of the terms. Next, the use of open-ended questions. An open-ended question is one that provides information to you rather than merely telling you they know the answer to your question. A yes or no answer tells to you whether the patient think she knows the information but does not allow you to assess the accuracy of information. Open-ended questions started with who, what, where, when, why or how. A answer to a closed-ended question will not reveal anything about her understanding and recollection of the information. Next is use of paraphrasing. Paraphrasing is a technique in which the pharmacist reframe what the patient has said in his own words. Through this, the pharmacist is telling the patient that the pharmacist has listened to the information and confirms that the message was understandable to the pharmacist. Use of paraphrasing is sometimes also called as active listening. Next is assertiveness. Assertiveness in patient counseling is the ability to clearly, directly, and respectfully express needs, concerns, and information, fostering effective communication. It bridges the gap between patient autonomy and provider expertise, improving treatment adherence, mental well-being, and health outcomes while reducing anxiety, stress, and misunderstandings. So the pharmacist, by doing assertiveness, pharmacist can express thoughts without blaming. Like I feel like that he or she can tell. I feel it. This is the way you should do. Then there is no need for the pharmacist to be authoritative, but he or she can tell the patient, this is what I feel. So that emphasizes the need for doing what he intends, but it is up to you to decide. I'm not taking authority over you. So that is assertiveness. Now we will move to the non-verbal skills. These are the different non-verbal skills. Non-verbal skills include body language aspects, proximity, touch, eye contacts, etc. Mannerisms. The pharmacist needs to make patient feel comfortable by enhancing physical and psychological privacy. Gestures, clothing, hygiene can provide information about the pharmacist and the patients. Facial expressions. This can be used in counseling to demonstrate empathy towards patients. Head movement such as nodding, hand gestures, and body postures also can be used for advantage. Eye contacts. The duration of time that people look at one another during a conversation varies depending on whether they are speaking or listening. For cultural or personal reasons such as sadness, depression, some people avoid looking into counselors' eyes. The best a pharmacist can offer is frequent and attentive eye contact and avoiding blank stares. Proximity. This refers to the distance that people maintain between themselves during counseling process. This space has been classified into four zones. Intimate zone, that is 45 centimeter or less. Personal zone, that is 45 centimeter to 1.2 meter. Social zone, that is 1.2 to 3.6 meter, and public zone, that is more than 3.6 meter. Generally, counselors or healthcare professionals use intimate or personal proximities. Touch. Touch can enhance verbal communication and facilitate social interaction with the patient. So that's all about some non-verbal techniques that can be applied in patient counseling. Now we will discuss different barriers to communications which may hinder effective patient counseling. First of all, the environmental barriers that include the physical layout of pharmacy, lack of privacy, and distractions. Problem with any of this may act as environmental barriers to proper patient counseling. The environment in which communication takes place is critical in pharmacy practice, and distractions within the environment often interfere with this process. Some environmental barriers are rather obvious, while others are more subtle. For example, in many community practice settings, glass partitions separate patients from pharmacy personnel. Although these partitions provide a private area for staff to work, they unfortunately may intimidate some patients and inhibit communication between patients and pharmacy staff. This type of environment may also give patients the impression that pharmacy staff do not want to talk to them. Ideally, the environment should provide areas where staff and patients can communicate face to face without physical barriers. This will also help counteract patient perceptions that pharmacy staff members are not approachable. Also, the crowded, noisy prescription areas also inhibit one-to-one communication in many practice settings. Many pharmacies have significant background noise such as people talking or music playing. These noises interfere with the pharmacist's ability to communicate with patient. Privacy is especially important when pharmacists want to talk about personal matters. Noise also interferes with the a pharmacist's ability to use the phone effectively when trying to communicate with physicians, patients, and others. Many community practitioners have tried to address these issues by increasing the amount of privacy with planters or room dividers to create the feeling of a private conversation area that is away from common traffic areas. Some have installed private or semi-private counseling areas or rooms. Privacy does not necessarily mean having a private room, but both the patient and pharmacist must feel that privacy exists. Even in a busy, noisy environment, privacy can be enhanced by moving to the end of the prescription counter or by turning away from a busy prescription area and lowering the pharmacist's voice to achieve a more private environment. The first step in removing environmental barriers is discovering which of them exist in the practice setting of a pharmacist. One approach might be to view things from the other person's perspective. Next is the patient related barriers. Several personal barriers relate to patients. For example, patient perceptions of pharmacists and pharmacy staff are critical in establishing communication rapport. If patients perceive the pharmacist as not being knowledgeable or trustworthy, they will tend not to ask questions or listen to the advice being offered. Therefore, pharmacists may need to alter negative patient perceptions by informing patients that pharmacists sincerely want to communicate with them and by actually counseling them effectively. Some patients sense that the healthcare providers are not concerned about them as individuals but rather as cases or disease states. This will also hinder counseling. Patients' perception of their medical conditions may also inhibit communication. Some may believe that their condition is a relatively minor one, requiring no further discussion with the pharmacist. In contrast, some patients may be overly anxious about their condition and therefore will avoid talking about it because they feel so vulnerable. Some patients may feel that their physicians would have already told them all the important information about their condition and their medication. Therefore, there is no need to talk with the pharmacist. Some patient may be having anxiety regarding the language differences with the pharmacist, and some may be low literate patients, and some may be having here sensory abnormalities or comprehension difficulties. Some may not be interested, some may be coming to the pharmacy just because forcefully taken by somebody else, but they don't believe in this kind of health practices. And usually patients may not be having time. As I already discussed, they come to the pharmacy at last and they just want to run away from the pharmacy. Next, the administrative barriers, time barriers. As I already discussed, time barriers is very important because choosing an inappropriate time to initiate conversation may lead to communication failure. The timing of the interaction is critical since both the patient and the pharmacist must be ready to communicate at a given time. Sometimes the patient may be busy, sometimes the pharmacist may be busy. This should not happen. If such things happen, if the if such unavoidable situations are there, a possible solution might be to give the basic information to get the therapy started and then contact the patient later through phone or email when both of the pharmacist and the patient are maybe more relaxed and ready to communicate. Another strategy is to have written information that can reinforce short message during busy situations. Many pharmacists make efficient use of time during these brief counseling encounters by highlighting pertinent information within the written information to emphasize key points before the patient leaves the pharmacy. Administrative barriers are also there. Several factors dealing with the administrative aspects of pharmacy practice serve as barriers to communication. For example, most community practitioners are not paid directly for educating or communicating with patients. Counseling services are not included as part of pharmacy's business plans. Unfortunately, pharmacies often make policies that discourage pharmacist patient interaction. So, increasing the number of pharmacists or the staffing policies may also help in improving the patient counseling. Many pharmacies have reduced number of staff members who can assist the pharmacist. So all these are barriers to communication that needs to be effectively tackled to undergo uh, proper patient counseling. So as a summary, I can say like interpersonal communication, because of its complexity and human involvement, is a fragile process. Messages become helpful to others only when they are accurately received and understood. If messages are distorted or are incorrect, they actually may be harmful to patient care and interpersonal relationships. Failure to communicate may lead to negative patient outcomes. Barriers such as the ones discussed here may lead to distortion of messages and misunderstandings between the pharmacist and others. Thank you.